Mark Daly at Summit 2011, Paralysed Veterans Health Summit, and the person who has pulled this all together with her team is with me right now, and she's Lana McKenzie, RN, MBA. So mixing a clinical background with a good business sense, Lana McKenzie. How are you, Lana?
I'm doing well, thank you.
It's good to see you.
Good to see you too, with your checker shirt.
Yeah, and the little black dress today, is it? You're looking great, and I heard a little bit of your remarks this morning. How do you think the summit's going so far?
I think it's going very well with great turnout. All we heard is positive comment from food, the flow out of the floor plans, the sessions, the education piece of it, and I'm so excited.
Yes, I know that you have a message about the summit this year because, I mean, it's all these different disciplines of clinicians, but what are they here to do, really?
Well, we're here to do a few things. First of all, is sharing knowledge. That's the first, foremost important piece of being a clinician. Equipped with knowledge and not able to share with other colleagues that doing the same thing you do. And that's how it began. I got a scholarship from Paralysed Veterans of America way back when I was in my 20s, and that's where it introduced me to the world of spinal cord injury practice. But going forward, this is 2011, and there is so much complication in the care of a veteran with spinal cord injury disease and MS. Is marry the two sides of the house and understand the complexity of these type of patient is important for us as clinicians. And I'm proudly to say that this has been a great turnout, and I hear all positive comment from both sides of the clinician that thank you for bringing us together. The integrated approach is excellent.
And of course, it is about, as you say, integrating disciplines. It's also, as you said, very importantly, about earning educational credits, as well as getting a scholarship from Paralysed Veterans of America. And I know that Paralysed Veterans campaigns and advocates 24/7 for quality health care, and that's what you and your staff do when you're not doing the summit.
Yes.
Tell us a bit about the challenges that you face out there at the minute, you and your staff, Lana, because, for the most part, VA healthcare is very high quality, but, you're always campaigning for it to be better, and I guess for it to be better funded. And one of the things I've heard people say is nurses, for example, since you're an RN, a nursing shortage that you hear people talking about. Tell us about that.
Well, nursing shortage is nationwide. It's been an ongoing challenges for us practice in the nursing field. But nursing alone to provide spinal cord injury is another challenge because it's providing care for spinal cord injuries and veterans or patients with this complexity is challenged. So retaining and recruiting are ongoing issues at all levels, veteran healthcare or private healthcare. So that's one of the challenges that the nation is facing. We recognize that the care is at the bedside, and when you lack of those resources, the quality of care is affecting. And that's what we are doing is we'll keep the eyes on the ball. We conduct survey solely because we want to enhance what you do. If you have been doing a great job, we want it to better. And there's no such thing as lack, of room to improve. So that's one of PVA Pep Talk is we're here to help and assist you in identifying things that might not be in your, circle of recognition. Little thing like housekeeping. If you don't have good housekeeping, the infection rate is outrageous. Little thing like that, and we're proud of what we do because Paralysed Veterans not only identify issues, we offer solutions. We do that ongoing.
Indeed, and just in terms of thinking ahead, one of the questions I've been asking everyone that's been participating this week is that if we had a summit time machine and could kind of jump forward 10 years into the future, what are the sorts of things you might be looking back at in terms of progress? I mean, what's some of the things that you think, using your best hunch, if you like, what do you think is going to happen in the next 10 years in terms of breakthroughs and perhaps new treatments and therapies and maybe one day a cure for some types of paralysis?
Well, if you heard our senior leadership yesterday, they was hoping one day they'll be put out of business. And what that meant is that our work will be complete when there's a cure that discover for people who are able to get up and walk or regain more of their functionality, comparing to now. We already see lots of movement. If you heard Dr. Steve Waxman's talk yesterday, he brought a lot of hope to clinicians who do research, but also the user itself who's in the chair. I heard so many comments from our member that there's hope somehow. And as clinician, we always want to find things that how can we impact the quality of life in the next 5 years, a short term, 10 years, a long term. It's an ongoing discovery. I'm hoping to look back 10 years from now, if I'm still in business, that some of the discussion that took place here contribute to the outcome 10 years later.
Absolutely. Let's just look ahead a year from now. And I'm going to look up here and I see a sign. This is actually, for the viewers, I'm going to pan up here so they can see. But it says, see you next year in Las Vegas. So you're already, Lana, planning next year's summit in Las Vegas. And of course, what happens in Vegas might not stay in Vegas because it's something that you want, obviously, your summit participants to take away to all of their respective areas, what they learn in Las Vegas. Tell us about your plans for next year. And I know it's early days yet, but what are you planning? What are you cooking up for next year?
Well, it's never early to plan because it takes a lot of energy, effort, commitment, get people together for planning something this big. We already talking about topic to discuss next year, but I know for some of the outline, it's going to be in Las Vegas. It's a place to be sometime, when you have a personal and pleasure plan together. It's 1 year ahead, so you absolutely want to set aside a time, whether 3 days or 4 day, 5 day. We got great hotel to offer you. It's Paris Hotel in Las Vegas. And you're right, I'm hoping that what's happened in Vegas don't stay in Vegas. We really want everything that discussed, absorbed at these conferences to take back to the bedside, to the patient, to your practice. That's what different is about that theme about Vegas. As you know, we know how to put up together parties. So join us in 2012.
Lana McKenzie, RN MBA, the AED of Medical Services and Health Policy at Paralyzed Veterans of America. Thank you very much for a great summit, Lana.
Yeah, you're welcome, and enjoy the rest of the summit.